hello and good evening, everyone. This is me, Dr. Zaid Qureshi, and I'm here with my co-colleague and mentor, Dr. Alina Shirazi, with me. So today evening, we are going to start and we are going to discuss the tips and tricks of MRCOG Part 3 exam. Okay, a very warm welcome to all of you on the platform of MedExam Expert. So I'm sure all of you know us and who do not know, and I'm sure they will know us by the end of this session. And obviously, many of you guys know what exactly the part 3 is and how we are going to prepare for this exam. Okay, so this session is going to probably give them some extra piece of knowledge, but basically this session is also for those candidates who have just cleared their exam. Okay, and they are also waiting for part 3. So luckily, this time we are very lucky all around the globe that we have got almost, all of us have got the chance to go for exam, especially in November. And then whoever will be left will have the great chance to appear in February exam. Okay. So it is very much advisable that all of you guys, just start preparing yourself for this exam and just try to look for the best study buddy, try to look for the best study sources. Everything is there. All you have to do is that you just need to know what exactly part 3 is, then which path to choose and how to go, and that's it. Okay, so naturally if somebody who has passed part 2 is very much eligible to go for part 3. Okay, so we will try to speak on this thing, that how we are going to behave and what exactly the part 3 is. All right, so Dr. Alina, are you there?
Yes, Dr. Zaid, I'm there. Hello, everyone. Hi, it's really nice to see you all there. Thank you so much for joining. Yes, Dr. Zaid, I'm here with you. Let's start.
Okay, fine. Let's
Okay.
start. Yes,
Yes.
let's start. Okay. So first of all, MRCOG Part 3 format. This is for the people who are new to this exam. So obviously they will, come to know that what exactly this Part 3 is. So we are going to have total 14 stations. I'm sure you all know that this is a OSCE exam. Okay. So then out of these total 14 stations, you will have 2 minutes reading time for any of the station. And that obviously is going to be outside the cubicle, and 10 minutes is going to be inside the cubicle. Okay, and we will show you and we will tell you how to behave in that 2-minute reading time and how to behave in those 10 minutes inside the cubicle as well. And usually there are almost now 7 half and half, but sometimes there can be 5 to 6 or 7. Okay, structured discussion tasks, and some are going to be role players, and out of them almost 4 are going to be with lay examiners. Lay examiners, whenever they are going to be there in any of the station, that station will carry the highest marks in exam. And some of the station can be linked station. Okay, for example, if somebody has had conceived with, is a known case of PCOD, and now she is here to discuss her fertility options, and probably the next station could be, okay, now she has conceived, and now she is here to discuss about her birth plan, because she is now with twin pregnancies, 34 weeks, 32 weeks, or whatever, and so and so. This can happen and this cannot happen. Then there is no rest station at all, that you have to utilize your 168 minutes, one after one. There is no break, no rest station. But yes, in that, if you want, water, if you want extra pencil, if you want, anything, this is for kind of, I'm talking about the on-site exam. But this time this is going to be online. But yes, again, you will be given full kind of, the instructions how to behave in the online exam as well. Okay, so yes, there is no break. Total you have to behave in like 168 minutes, and then this exam is going to be over. So this is a general, the on-site kind of, the exam hall. This exactly is like this, that this is how the candidates will stand. They will just move from station number, 1 and so and so. And for example, if somebody is at station number 2, then they will follow. And there are going to be people who are going to guide you. And yes, this is for on-site exam. Similarly, in the online courses, because it's on Osler system. And in Osler system as well, there is going to be technical team, and that's going to be behind the scenes, and those are going to be guiding you at every step. If you have any kind of problem in any of the station, or if you cannot see the screen, if you cannot see the examiner or lay examiner, or even the the role player, they will guide you there and then. Okay, so this is exactly the look of on-site exam. So this somewhere you can see, in many, this is going to be the simulated question task with lay examiner. Where do you see four, the people inside the cubicle? So when you enter into the cubicle, just, have a quick glance in that cubicle, that how many, the people are in that cubicle. So if it is with lay examiner, obviously you will be having, the four people, including you. So you are the, one examiner, one lay examiner, and the role player, and then fourth one is you. If it is only structured discussion task, then yes, there is going to be only examiner who is going to behave as your consultant. Then if it is only simulated patient task, you will be facing only three people into the cubicle. So what does it show? It shows that, and while you are entering into the cubicle, you have this idea that, what this station is going to be. And naturally, you have read everything outside, especially this will work in these two scenarios. Okay. Simulated patient task with lay examiner, and simulated patient task with, one examiner and one role player. So this is very much important, that you should be oriented in time, place, and person. Okay, so now this is online exam, and this is computer based exam. So at least you should be well versed with computer, okay, that how to enter into the exam hall, and that is on the Osler system, okay. And the candidate and role player, structured discussion, examiner interaction, everything will be online, and it will be on video conferencing with the help of Osler system, okay. So regarding Osler system, you will get each and everything before your exam. You will have your login ID, you will have your password, and the RCOG will guide you. The technical team is so good there that they will guide you that how to enter into the Osler system. They will give you like a week or so to just test your computer, to just test your internet as well. Okay, and this is now your job, since it is online. So at least you can have, one good international internet connection. It should be very strong, with good streamline, and with good, the connectivity, everything. So even if not, then it's better to have, the two or, more alternative internet connection. So everything will be online, and once, we are done with this thing, so probably we will be arranging, the few of the online sessions as well, where we will be playing as a role of, the examiner, and probably one of you, the candidate, would be playing the role of the candidate as well. Okay, so probably in near future we will do the same as well. So just to give you the feeling that how are we going to behave in real exam, because obviously you have to see the face, you have to see the emotions, you have to see the body language, you have to see, how somebody talks and behaves in real exam. Okay, and this exactly has happened, because recently, alhamdulillah, I have been given chance by college to be an examiner for part 3. Okay, so I did examine for 2 exams, March exam and the July exam, May exam, in fact. Okay, and those have been a very wonderful experiences for me. Me myself have learned a lot as well. Okay, even I was an examiner at that place, but still it will give you a very good feeling when you see your examiner and role player online. So it will give you, the very, in fact, pleasurable feeling as well, apart from the exam stress and all, because you get to see, I mean, through video conferencing, you will be seeing each and everybody, whoever is in the exam in particular station. Okay, so online system, don't be afraid of, it is going to be same like on-site exam. There is no change of time, there is no change of anything, so it's going to be similar. Okay, so only difference is that now you are going to appear from your home. That's it. So in home, what you have to do is, obviously you need to be in a quiet place. You need to be in a place where you cannot hear outside noise. So there should be a good, the working laptop or desktop, whichever are you using. There should not be any, the iPad or phone. Okay, this is also a good thing. So you should have at least, the Windows installed, the good one. They will give you all instruction. Okay, they will send you an email before that. Okay, that to support this Osler system, your system should support Osler system as well. Okay, in terms of technicality and everything. So they will guide you at each and every step. And if somebody faces any kind of difficulty, the technical team at college is very, supportive, and they are very responsive to emails and the calls as well during exam times too. Okay, so they will definitely guide you there and then. So don't worry, and don't be afraid of online exam at all. All you have to do is that you have to have a strong internet connection. That all, either 1 2 3, whichever you can arrange, that is good for you. Okay. And but the internet connection should not be lousy at all. It should not be very the bad, and there should not be some kind of the breaks as well. Okay. So you need to have a very good internet connection. That's all college needs. That's all college needs. And now this is your responsibility, that how you are behaving in the exam with all of your available resources. Okay. So in nutshell, again, don't be afraid of online exam, because I do get so many the messages from candidates here and there that madam, please tell us that how is it going to be. Do we have to look like this? Do we have to look like this? See, this is an exam, so obviously you will behave as like you are going to your on-site exam. Obviously you have to be prepared for your exam as well. You have to look good. Obviously if you are appearing from your home, so obviously you are not going to be in PJs, you are not going to be in the home dresses as well. You need to look formal, because obviously this is an exam. You need to wear formal, you need to look comfortable as well at the same time. Okay. So yes, you are not going to walk, so yes, you can be bare feet, but obviously you need to look presentable. Okay. And regarding many of the candidates, they are afraid of scarves and everything, if they are Muslims. So don't worry about it. You can wear scarf, you can wear whatever you want to, but be comfortable in your own attire. Even if you are at your the own home, at any of your comfortable place. Okay. So you can be yourself, look confident, appear confident, look the calm, and that's it. They are not going to judge you on your looks, they are not going to judge you on your beauty, they are not going to judge you on your the attire or anything. They are just going to judge you how you are behaving in exam, because at the end they just need safe, good, the doctor. That's it. All right. So regarding the attire as well, so it should be formal, it should be the very good. And don't wear the pink, red, purple, the bright shades. Don't wear orange. So black looks good, blue looks good, and white looks good as well. Okay. So it all depends on that how you want to look in exam. But yes, it should be very formal, it should be very simple as well at the same time. So it's better, and it's a very good idea that you be in your the coat pant or the dress pants. And then if you want to wear scarf, then yes, you can wear scarf as well. Okay. And for the hairs as well, it's better to tie your hairs, rather you are combing your hairs with your fingers and everything, and at the same time you are doing your hairstyles. No, don't do that. Okay. Because at the almost like 6 to 8 hours you will be online. So you will be online, you will be seen by so many the people around. Technical team will be watching you over. And certainly you are not going to see them, because they are going to be in our system. You will be seen by the the head of the examiner, you will be seen by many of the examiner, because there is going to be one examiner. And then there are going to be the hidden examiners as well. Okay. They are going to watch you, observers. Okay. So don't be afraid of anything. Okay. I'm just giving you an idea. Okay. That at least this is an online system. So what if the system collapses or whatever? All right. So naturally 168, 3 hours, 3 hours. So you need to be like presentable for good time. Okay. Exam is for 3 hours, obviously. But yes, because this is internet system, so you never know, anything can happen. So be prepared for anything. All right. Then domains. Obviously, everybody knows that what are the domains. So domains are going to be information gathering, communication. Communication will be communication with the patient and communication with relatives, communication with colleagues, applied clinical knowledge, and patient safety. Okay. So patient safety. No need to wear any white coat. Okay. No need to wear. All right. No, it's not going to be 6 hours. That's a matter of days. Okay. So I'm just saying that at least you need to be at least in that attire, that in where you can be comfortable. That's it. Because this is online thing. So any internet glitch can happen. Anything can happen, at both ends. So this way or that way, you have to be prepared. That's it. Okay. So information gathering, communication with patient and relatives, communication with colleagues, applied clinical knowledge, and patient safety as well. Okay. So you have to know about all these domains. Okay. And if you are in exam, obviously, so you will be judged on all these domains. And the scores, how you will get is that either it can be 0, it can be borderline, and you will score 1. It can be clear pass, that is going to be 2. And moreover, this is going to be in almost all domains. Then um, we have spoken about that, there are going to be some parts that are going to help you to succeed in part 3. Okay, that depends where is the problem. Okay, but naturally it should not happen. I'm just giving you, the one off event, or you can say that anything what can happen. Okay, if you come, if you have got some kind of internet connection at, the one internet connection, naturally you will switch to the second connection. And if you enter into this station with the given time frame, then yes, probably, they can give you chance. But it depends again, because there are going to be so many people watching you. Then there is going to be the collective decision of the all examiners and observers. So far what I have noticed in exam as an examiner. Okay, so this is what we had to do for, one or two candidates. So yes, internet glitches can happen. And if something is happening with you specifically, then yes, you also should have, some kind of alternate connections too. Now, again and again, I will repeat that this is candidate's job now, that at least you are with good internet connections. That's it. That's it. Okay. So now I want to talk about, and now Dr. Lina will also, try to give her input as well in this thing, that, what could be the things which makes us a good candidate to succeed in part 3. Okay, like I said earlier, we should look confident. If we don't look confident, we are with, some kind of weird expressions on our face when we will enter into the cubicle. So obviously it's not going to give a good feeling to the role player. They will say, and if we are shaking, and if we are not in the for example, if we are just, what I can say, that I mean, nervous. Okay, anxious, nervous, so obviously the feelings will come on your face as well. Don't feel that way in exam, because whatever it is, this is just exam. Like, I mean, we are doctors and we have been appearing in all type of exams throughout our life. So take it as another exam in your life as well. Okay, so appear as a safe doctor, because at the end, when once you are MRCOG, so if you want to pursue your career at NHS, so obviously NHS is looking for safe doctor, safe practicing doctor. So you should be logical, and it should be the organized thing. For example, whenever a patient comes to us in our clinic, when we are doing our clinic, so what we do whenever somebody comes to our clinic, we don't just look at their faces and then we will just write out the prescription. We don't do that, right? So we do take history, we do examine, we do run some investigation, and then we do the management. So same rule will apply here in every station, in any of the tasks as well. You have to take history, that is information gathering. Okay, you have to communicate. So this way they are going to judge us that how we are going to communicate with the patient, and if it is structured discussion, then yes, how we are going to behave with the colleagues as well. Plus, in terms of colleague, obviously we have couple of colleagues too, like the midwives, like nurses, GPs, and the other specialties as well. So this is our job, that where we want to involve, the other specialties and other, the healthcare professionals as well. So everything should be logical, everything should be organized. Plus, you have to give reason for whatever you are doing. Okay. For example, if you are, writing out any kind of prescription, so you have to tell that why am I writing this thing? Why am I running this test? Because I have to look, something. I have to go for something. Okay. Then sympathetic and empathetic. This is in the roles of the role player. Obviously, you have to be patient as well. Don't just be in hurry to bombard patient with whatever you have memorized so far. Okay, whatever you have practiced so far in any of the station. And you should be active listener as well. If you are not a good listener, so you cannot interpret anything, you cannot counsel anybody regarding anything, and you cannot obviously manage any patient. You need to use simple, understandable language in a polite tone, and change your character and be embedded in the role of a doctor in any specialty at the time of session. For example, in one cubicle, you are breaking a bad news. In next cubicle, you have to give a news of, something. In next cubicle, you have to deal with, the cancer patient as well. In next cubicle, you are dealing with laboring women, you know, so many, for example, and this is a normal, the human psychology, that we do feel something, after like coming out of one station. Obviously, sometimes if station didn't go that well, so we will feel like, okay, come on, I didn't do good in this station. What I'm going to do in next station? Okay, so this all will depend upon. So in next 2 minutes, you have to gather yourself up as well, and then you have to, prepare for next station too. Forget about previous station. Forget about whatever you have done in those, earlier 10 minutes. You have to gather yourself in next 2 minutes, and then you have to think for next station as well, because it takes time for to, because in oscillator system you will get 2 minutes and 30 seconds. They give 15 seconds to enter and exit the cubicle. Okay, so this is going to be extra time for you, so don't worry about it. But in, the on-site exam, like we did, we only had only 2 minutes. Okay, so in those 2 minutes, you have to see the station. You have to, make up your mind about next station and forget about previous station as well. All right. So I think from my side, I think this is going to be a good idea, that, probably this all together, this is going to help you that how we are going to succeed in part 3. Dr. Alina, would you like to give your input in this thing?
Yes, Dr. Zay, thank you so much. Actually, these all are the most important tips to pass the Part 3 exam. And I believe if you could follow all these tips, it's really easy, very easy to pass the exam. But a few more points I just want to add on here. Always try to be very well targeted while taking history. I've seen some of the candidates, they waste a lot of their time in taking histories, like 4 to 5 minutes only in the information gathering. So you all need to be practice how to be very much well targeted while taking the history. Okay, for example, you have a patient with the heavy menstrual bleeding. I know that it's important to ask about like the pattern of the bleeding, how many days she bleeds, after how many days. But if you already have a report of biopsy, for example, the lady is having endometrial hyperplasia with atypia, then there is no need to to be much more focused on these things. Okay, the important thing is just ask from the lady about how she is feeling nowadays and what's the pattern of the bleeding. Just the open-ended question. Then there is no need to rule out other things, the symptoms of malignancy, the feeling of mass. There's no need to go into the depth of the heavy menstrual bleeding because you already have a diagnosis. Just try to manage it. Okay, and be focused on those things which are actually required to pass the exam. For example, just check the full blood count, and there's no need to repeat the scan, because if the biopsy report would be there, definitely they will have a scan and then she go towards the biopsy report. Just take her a permission that we want to check your scan report after your permission. Okay, you have to be very much well targeted. Don't waste your time in taking a lot of long histories, and just try to be very much well focused. Okay, on the task, which things are actually required for the task. Okay, exactly. And the second, and like another point I just want to add on is, at the end, do ask from the patient, like, is there anything else they want to add on, or any questions, because it comes under safeguarding concern. Okay, exactly. Any questions? It is very important to ask questions from the patient. When the patient complete, after information gathering, just ask any other thing, any question, any point that you want to add on. So maybe the patient would express something else. Okay, this is just a part from my side.
Exactly. So altogether, if you guys just focus on these salient points, so yes, this is going to help you to sail through this exam, okay, smoothly. And now I want to address another thing, which is reasons to fail part 3. What are the reasons where the candidates, fail in part 3? Okay, so for me, this is probably, the biggest reason: failure to have a persistent and consistent daily practice. All you have to do is practice, the stations, practice different stations. Okay, if you cannot practice with your any of the study buddy, practice it with yourself, record yourself, listen to yourself, correct yourself. Okay, or even if not, then practice stations in front of mirror. Look at your face, look at your body language, look at your tone, and this way you are going to judge yourself as well. All right, so this way you can also have a good practice. But this, for me, I think this is a very drawback, a very biggest drawback to fail any, especially this part 3. Plus, believing the myth that knowledge will not be tested. Many candidates think that, okay, this is just communication skills exam. So, okay, all right, I will just, cram up with the all patient information leaflets and everything. And this is just, that knowledge is not going to be tested. Wrong. All right. Your knowledge is equally going to be tested. Plus, believing that it is a pure knowledge test and just communication skills. Anything. Okay. So don't just think about it. All you have to do is that you have to balance things up. All right. So all you have to do is that this is clinical knowledge, but this is applied clinical knowledge. They are not going to expect, like, 100 pages guideline from you in one station. But obviously, if you do not know the summary, if you do not know the major stuff of the guideline, then yes, probably you are missing something out of that station, and probably those are the exam marks. If you use too many jargons, this is also, the reason. If the role player doesn't understand what you want to convey, what you want to say, what you want to give her the management options as well, then yes, this is going to put you in difficult situation as well. Relying on courses or material gathered from here and there. Okay, probably this is also a biggest mistake what candidate do. Okay, and you won't believe till date, since it's been like 2.5 years for me to pass this exam as well, candidates still ask me that, do you have this template, do you have this template? I always reply, okay, yes, we can make template, but you cannot be someone else. Be yourself in exam. All right, if you repeat somebody's, the phrases, if you use somebody else's phrases, so what happens by the end? You are not being yourself, you are being someone else. I always say you yourself are unique. Okay, so try using your uniqueness into every station. What we do when we are in our clinics, am I going to behave like Dr. Alina, or Dr. Alina is going to behave like me in her clinic? Obviously, no. She is going to behave Dr. Alina, I am going to behave me, Dr. Zaid, myself. All right. So yes, we can pick, the good parts. We can pick some of the good things as well. But please, please, please refrain yourself from using, the similar phrases in every station. So I believe, and plus, the courses and material. Yes, you can take help. Okay, you can take help from the material provided by anybody, or, the material available here and there, but just don't, try to engulf them. Don't just try to be that person who have made that template. Okay, because certainly when we speak, probably I can convey this thing into, some other phrase. Probably some other candidate can convey this thing into some other beautiful phrase. So yes, that is going to give you a unique beauty. So be yourself. Okay, don't rely on any of the courses, don't rely on solved material, don't rely on, the solved templates. Or if you really want to make template, so make your own templates. So this is going to give you boost, this is going to give you idea, this is going to give you, a good kick start as well for this exam. So believe in yourself, believe in yourself. And reasons to fail part 3, this one is also there. Lack of confidence and overconfidence too. Overconfidence, oh yes, I know everything. Okay, I have just recently passed this exam and I have scored this high, and this part 3 is nothing for me. So I will just go and I will just pass. I will just, do this thing. This thing can also give you a negative impact in exam, and lack of confidence as well. So be moderate, be moderate. Okay, so if someone who have passed this exam now, or if someone who have passed 3 years ago, so it doesn't give us, any kind of extra edge over one another. Okay, so just be yourself. Okay, there can be some, kind of different times, like this time, the COVID era. For 2 years, everything was paralyzed. For 2 years, everything was like stopped. So yes, we can, it's not like that, if I have passed exam 3 years ago, it doesn't give me any kind of extra edge. But probably, yes, it has given me, this kind of edge, that yes, I am at this level that I can, kind of guide somebody in a good way or a proper way. So yes, be yourself, be confident, practice, and don't rely on, so many sources here and there. All right, Dr. Alina, would you like to add something?
No, Dr. Zaid, actually, yes, you are right. Try to be yourself. If you would
Exactly.
much focus on the material and the templates of
Hmm.
others, then you would be
Hmm.
confused at the time of your exam.
Exactly.
Okay, try to be real.
Hmm.
That's the point.
Exactly. That's the point. And obviously, you are going to appear in exam, so you have to, be yourself. If you are not yourself, if you are behaving like me or anybody else, So what will happen in exam? So you will be confused in yourself. You will be confused, okay, what part to play and what part not to play. All right. So be yourself, take help. Yes, I always encourage to take help. I always encourage to seek, any kind of guidance. And this always gives you a good boost. All right. But don't try to learn phrases from here and there. Yes, it does look fake as well at times if we want to, pretend somebody else. So it doesn't look nice and it doesn't give a good feeling to the examiner as well. Okay. And yes, for the English language, a few of the candidates has texted me even today. I don't want to name them. They are here as well. So they have asked me that do they test our English, the speaking skills as well? So answer is no. This is not English language exam. This is not, the occupational English test exam. This is just MRCOG exam. Okay. So but yes, you have to have this much of English knowledge that at least you can communicate, because certainly you are appearing in international exams. So yes, you should know about the basic English, about the basic, the English phrases as well to communicate with role player. Okay, so they are not going to cut your marks on English language at all. Okay, so don't worry about it that you have to pass OAT or you have to pass IELTS before exam. We will talk about it, Rukaya. Don't worry. Okay, we are coming to that point. Okay, so what exactly part 3 is? Like we have spoken earlier, that it's a combination of your knowledge blended with your communication skills, but the applied clinical knowledge. Okay, so you need to use good communication skills and you should use your applied clinical knowledge. Okay, and it should be a balance of the both in part 3. Then yes, domains we have spoken about, and now we will come to the domains. Okay, information gathering. Like I said earlier, if somebody comes to us in our clinic, so what we do take history, right? We do examination. If given, we don't have to do any examination in real exam. Okay? Because in real exam, what happens is that after, like, task in 2 minutes time, they will give you that patient has been examined and the examination finding are on the next page. Okay? So probably you will see examination finding on next page. Okay? Or 2 pages if there are any investigations as well. Most of the time you don't have to examine in exam, because this is just a 10 minutes exam. So obviously this is not long case. So in long cases, yes, we may need to examine the patient, but not in OSCE station. Okay. Or if you think that you have to ask in some of the station, the station will not go forward if it is structured discussion task. For example, this is a preterm labor, the task, and now examination wants to discuss with you. So obviously from the background knowledge, we all know that what are the risk factors of preterm labor. So what are the complications of the preterm labor, and then what in the terms of management. So obviously the management will start with history, examination, and again investigation, and then you will offer something to the patient. Okay, so unless you speak, unless you utter yourself that okay, I would like to go for full blood count. Okay, I would like to go for full blood count to see patient's hemoglobin status, patient WBC count, to look for any of the infection, because in acute infection there is going to be raised WBC, white blood cell count, okay, from the baseline level. So that could be the cause of preterm labor. I would like to have a baseline look of the platelet count as well. Okay, so unless you don't say full blood count, examiner will not show you full blood count report. Okay, unless you say that I want the high vaginal swab to look for any infection, that if you will say that okay, yes, I want to go for high vaginal swab to look for an infection, because that could be the cause of preterm labor and the rupture of membranes as well in some cases. Okay, so if you say, that examiner will pass. So yes, in investigation you will go like this. If you say that I would like to examine this woman, I just want to do the per-abdominal examination to look for some fundal height, the height of the fundus, the fetal heart sounds, and palpable uterine contraction. I would also like to see the uterine, the softness, or if it is tender or not, because I have to exclude the acute event that can lead to preterm labor as well. So if you say, that examiner will pass on the sheet as well. Okay, so unless you say and unless you justify whatever you have said, okay, you are not going to be provided with any of the examination findings or any of the investigation findings. Okay, so if you see that this task need some of the examination, or this task need some of the findings as well, then yes. Okay, this is for structured discussion. For history station, you are doing in simulated patient task, you want to take history. So just spend at least 3 to 4 minutes, good 3 to 4 minutes for history or information gathering, because this is just only 10 minutes task. So if you take 4 minutes, 5 minutes, 6 minutes, 7 minutes for just history, so when you are going to manage this patient, because in the last 30 minutes or 30 seconds or 1 minute, you have to invite questions as well from patient. Because if you do not, complete the loop, the station is not going to look complete as well, because the ones you will greet, and if you do not say, have a good day in the end, or goodbye, take good care of yourself, or do you have any other question, like Dr. Alina said earlier, that we have to ask, we have to invite questions. So unless you complete the loop, the station will not look complete. Okay, so take history in like 3 to 4 minutes. Good, I think 3 to 4 minutes are more than enough. And then in the next 5 to 6 minutes, you just manage the case and invite question as well. In last 30 seconds should be at least the spare to invite any question. If role player has any other question, so she will ask you, because by the end of any station you have to invite question, and you have to give patient information leaflet, support group, and everything. Okay, so this way you can just have information gathering. Then second is applied clinical knowledge, second domain. Okay, applied clinical knowledge, when we say it is applied clinical knowledge, it means this is going to touch your all green top guidelines, TOG articles, and some of the strategy cases as well. All right. So this is very much important, that you should be well versed with green top guidelines, TOG articles, but yet again, not almost all, but at least, you should know. For example, in any case, you want to apply your knowledge. So obviously, if you have any background knowledge, then you are going to apply for the management of any case. Yeah. And for structured discussion, yes. For structured discussion, obviously, you have to speak in a tone, in a language, like you are speaking to your colleague, to your consultant. Okay. Then do not use the simple patient-friendly language. Okay. Because, we are at that point in, many of the cases that we do speak in that way as well. But with the help of, with the passage of time, with multiple practicing of the stations, it will come. Okay, so revise your green top guidelines again and again, TOG articles, strategy cases as well. Okay, so this is very much important. Then communication skills. So usually communication skills have got, the couple of basic ideas. That first and most important communication skill is to develop to become an active listener. If you don't listen to role player, if you don't listen to your, the candidate, so how you are going to, extract that what exactly this candidate or the role player want, or the examiner want. So you should be an active listener first. Okay, and I think this is a basic communication skill in our day-to-day life as well. If we don't listen, then how we are going to respond? All right, so be an active listener. Then second is that at all times you have to remain professional, and it should be very objective, like Dr. Alina said earlier, that you should be very targeted. Okay, you should be very targeted. So it should be very professional, it should be very calm, and you should be very targeted. The third communication skill is to always think before you say anything. And in exam, I always say think twice before you utter anything, because every second matters in exam, because this is your exam. Okay, this way or that way you have to pass this exam, and everybody who wants to go for exam, naturally, he or she wants to come out successful. All right, so think before you say something. So there should be a good communication between your tongue and between your brain. All right, and there should be a good communication from one person to the other person as well. The fourth communication skill relates to how you discuss the seriousness of a situation. Okay, like breaking bad news. So this is very important. So breaking bad news is another, kind of a tough scenario in part three, the preparation. And I'm sure all of you know that how breaking bad news is, that, you want to tell somebody on the histopathology report that she has endometrial hyperplasia, which is atypical endometrial hyperplasia. Or for example, this is the cancer, this is the CIN3, this is the severe dyskaryosis, or she has, any kind of, the bad news. In obstetrics, it could be, any of the ultrasound, the anomaly. and you have to deal with the woman, pregnant lady, you have to tell her regarding, or the Down syndrome screening is not good, it is high. Okay, so in that case you have to break bad news, and there are a couple of the good points that how you are going to break the bad news. So obviously this will also come in communication skill. For example, you have to say something to someone, so you're not going to say, hey, look, your baby has died in the womb. Obviously, this is going to give a bad impression. All you have to do is that you will set, the scene, you will make, this is kind of, the idea about that you are going to tell something bad to a woman. So at least you will prepare her to receive that news as well. All right. And on breaking bad news, I think Dr. Pooja has done a very brilliant, the session, and I think it's available on YouTube as well. Okay. So if anybody wants any kind of guidance on breaking bad news, can always refer to that YouTube, the session as well. I think she has done 2 or 3 scenarios on breaking bad news. Okay. Dr. Alina, would you like to add something in this?
No, thank you, Dr. This. It's
Yes.
wonderful.
There is a question, in case of taking consent for a procedure, do
Mhm.
we need to take detailed history to rule out other causes of the condition? See, when you are taking history, so obviously you will just take history, and how you will take that, you will take, that why she's here, okay, number one, and that, we are going to talk about this, that we are going to take consent for you. For example, you are here for total abdominal hysterectomy. So obviously, you will talk about other things. Have you had any kind of operation before? No. Any operation on your tummy or down below? No. Okay. Are you allergic to anything? Because these are safety point. Are you allergic to anything? So she will say no. Okay. So do you have any reservation with the blood? Because we know for the hysterectomy that she may need some kind of transfusion as well. Yeah. So if she has any kind of reservation, then you will have advanced directive in Jehovah setting. Yeah. So you have to do that. All right, Amber. So yes, you have to rule out, the other causes of the condition. No, you can, because if she is here for consent, it means that either she has been counseled or she has explored all other options. So you will ask in only one sentence. Have you tried any treatment so far for this condition? What was the outcome? Was it good for you? What was the, the outcome or anything? So this way, I think you can, sum up. Okay. Thank you so much. Thank you so much, all of you. So I do try to, be as helpful as possible. So is it clear, Amber? Okay, Ambrish. I'm sorry if I am pronouncing your name. Okay, okay. Nice, Praneeth. Thank you. Okay. So I think this is for communication skills and communication with patients and relative. This is also an important thing. You have to look empathetic. You have to look sympathetic. Okay, hang on, stop. Okay, when you are showing sympathy, so don't bring those expressions on your face that you will cry before the role player, because trust me, in RCOG you will have very toughest role player. They are professional actors and actresses, and they are trained to do their job very well. So, for example, in Breaking Bad News, they will cry, they will give you tough time or everything. So, at least, I mean, be confident and be, kind of composed as well at that time. Okay? Be composed at that time. Don't just bring those expressions on your face. Okay, yes, we are equally feeling bad, and we do actually feel bad when we do, give bad news too. So obviously, we have to be in a good, the position that at least, we won't cry or we won't be like carried away by, any of the role players or the patient's emotion, in fact. Okay. So you have to inquire about patient's relationship with their family and relatives, how far they live from hospital, can they come in emergency, do they have their own transport or phones available at homes as well. This is also an important question. For example, if you are talking about somebody who wants to take home birth trial, somebody who wants to have, any kind of, or, the conservative management at home. So obviously, okay. So, or in cases of APH as well, you have to inquire about that. How far do you live from, the hospital? Can you come in emergency? Do you have your own transport, or do you have, the phones available at home? So this is very much important that in some cases utilize this knowledge. Plus, don't show your anger in response to their anger as well. And this can happen. If, for example, obviously, if somebody who is coming here to discuss her biopsy report, okay, her biopsy report, if she's coming to discuss her biopsy report, so, and you are giving her, the information that, okay, you have developed, any of the pathology, bad pathology. So sometimes they can give you any kind of, the, I'm sure you all know that, the reaction to any of the breaking bad news is something, sometimes they will feel anger. They will be, kind of very furious at you. Then there will be a stage when they will accept it, and then they will try to, communicate with you that how you are going to deal with. So then probably, then yes, this is going to be a toughest situation as well. And plus you have to deal with this anger in, in one breaking bad news. Then if any complication, okay, untoward complication, be it labor complication, be it, the post-operative complication as well, surgical complication or anything, okay, you can face any kind of angry patient as well. So plus if somebody is waiting for too long for the consultation, and now she is angry that she has been kept, waiting for so long. So don't overreact. This is an also good part. If they start crying, don't start crying yourself. Okay, listen to them patiently, interrupt in a polite way if you think it's necessary. This is also another, the good part of communication skills. If somebody will start go on, okay doctor, this has started when I was this and now this is this, and if you think that you have to tackle with three or four, the presenting complaint, then yes, you can interrupt in that way. Then you can interrupt in a polite way. Okay, yes, I understand that you are having these problems. Okay, so can I ask, but at the moment, which thing is bothering you the most? Okay, so this way you can kill this, the concern there and then. Okay, this way you can kill the concern there and then. If she's, if she keeps on talking and talking, so you will interrupt, but in a polite way. You will not say, okay, I will come to this afterwards. Okay, we will see afterwards. No, you will politely say, okay, I understand that you have all these issues, but can I ask at the moment which issue is bothering you the most? Okay, so this way you can interrupt. So don't impose your decisions on them. Be neutral. Give them all information. Okay, be open and honest. Tell them all, the options with all pros and cons. One, two pros and cons. Okay, then give them time to decide and be neutral. And yes, by saying be neutral mean there will be some of the scenarios where role player or the patients will ask you, so doctor, can you give me an idea which option is good for me? Okay, and this is, I think, a normal question which we do face in our day-to-day practice as well. So all we have to do is we have to look neutral. We can say, okay, look, Julie, I have given you all options, with all pros and cons. Every option has, some kind of, the pros, some, the good parts and some bad parts. So yes, you have got a couple of time, you have got few weeks to decide. So I will give you patient information leaflet as well. You can read, so it will supplement whatever we have discussed today. So you can come up, with any of the choice you make, and we will try to support you as much as possible, and we will try to respect your wishes as well. All right. So you have to be very neutral. You are not going to say, okay, yeah, I think this thing is going to be good for you. So this way, it means you are going to impose your decision, and certainly this is not going to give a good, the outlook to your station as well. All right. So I think this is for communication with patients and relatives. Dr. Alina, do you want to add anything?
Yes. Okay. So the same point, Dr. Zaid, if
Mm-hmm.
the patient say, no, we, like, for example, the fetus is having reverse diastolic flow, and patient is not happy with the plan of cesarean section, and patient agree for the vaginal birth, then you can say that definitely we are going to respect your wishes, but I'm afraid that it couldn't be a safe management plan if you opt for the vaginal birth. The safest plan for you is the cesarean section, something
Mm-hmm.
like that. If you think that the patient is thinking about something else, if the patient wants
Exactly.
something which is not beneficial for herself and as well as for the baby, then you can say something like that.
Hmm. Then you can say yes, like this, that this this can be, the good option for you. This way
Mm,
you can even,
mm,
say, you can mold your wordings. Okay, so
mm.
but you will not say 100% that okay, this is a good
Okay.
option for you. But yes, you can say that by seeing your, the report, by seeing your tummy, by seeing your, the baby's heartbeat, I think that this should be the good option for you. So do you think it's a
Mm,
good idea for you to decide, or do you think that
mm,
it's a good idea for you as well? So this way, you can give her some kind of chance that, okay, then she will think again. All right. So I think this
mm,
way you can mold according to the
mm,
stations again. All right. So this is communication with colleague. this is also a very, the important domain that you should know what are the responsibilities as a candidate are, okay? What are we at this level? Because at some stations you will see the question is that you are ST4, some stations you are ST3, ST5. So yes, you should know what are the responsibilities of what, the specialty training level is. And there is an NHS structure frame on this RCOG website. All of you can download it, and you can, read about, what are the different specialty training and what are their roles and responsibilities. Okay. So naturally at this level, to sum up, I can just give you a, the idea about it, that at least you should understand that what is going to be your responsibility, where you have to stop in management, where you have to involve your senior, where you have to involve your consultant, and the where what treatment can you offer at this level, okay, at what level you have to stop. It means at the same time you have to appear safe as well. At the same time you have to appear a candidate who is going to engage, the other healthcare professionals as well, like GP, like midwife. If you want to write back, if there is any referral letter, you have to write back. Okay. So colleagues can be MDT team. Okay. The MDT team approach, you will say in your, if you haven't uttered this thing, that in any of the scenario, for example, it's a diabetes, for example, it's an the cardiac disease patient, so obviously you need some other specialties as well. So if you don't say that, okay, look Julie, now we are going to manage you with the help of some other doctors as well, we call it as multidisciplinary team approach, in which we will have, your senior consultant as well, midwife as well, and blah blah blah. So this is going to give you good marks. Consultants you will involve. Okay, consultant where, for example, if somebody is here to discuss about the birth plan, and now you are here. Okay. Hmm. So this way you are obviously, and plus birth plan, for example, she is previous scar and now she is here to discuss her birth plan. So obviously for the final birth plan, you need to involve your consultant. All right. Midwife, when you have to, if the midwife has referred this case to you, you will write back to midwife. If it is GP, you will write back. When you have to involve anesthetist, when you have to involve anesthetist at early level, for example, if it is obesity, okay, obesity case, so you will involve neonatologist in all laboring, the woman, or in all, the cases where, you can find many of the neonatologists as well. Okay. So you will learn with the passage of time that at what level you will involve someone, and when you will stop in your treatment, especially the consultant, the role as well. This is very much important. For example, in post-operative, or for example, in surgical complications. So obviously you are not going to deal surgical complication alone. Okay. For example, you are doing the cesarean, and now there is a bladder injury. So what you will do at that time? Obviously you will call on your consultant, and then, the helpful team as well. So this will come under that when you are going to communicate with your colleagues as well. Okay. It's on RCOG website. Okay. It's on RCOG website. You
Sorry
can
for
find it out.
interrupting, Dr. Zaid. I have added 2 to 3 slides related to the system of NHS and specialty training.
Yes, yes,
Okay,
yes.
so I will
Okay.
show okay. So 2 to 3
Okay, okay.
slides so you have an
Okay,
idea about
okay,
it.
okay. Okay, okay. Okay, Salma. So we will show you ourselves. Don't worry. All right, so let's just finish these domains first. So colleagues, so sometimes there can be pitfalls as well, that sometimes candidates do not adopt a logical, reasonable approach in any clinical scenario. They do struggle to convey clear and the good summaries. They do face some kind of problems in writing legible, logical, and ordered clinical notes, and failure to use of structured system of communication. And sometimes they do not understand, what are the MDT roles as well. Okay. And the last, the domain to talk about, safety. Safety is very much important. Safety is very much important in our day-to-day practice as well, isn't it? So similarly, in the RCOG, in the NHS system, so we are going to talk about this in a way that obviously, because as an overseas candidate or any of the candidate who wants to work at NHS, he or she should appear as a safe and good practicing doctor. So simple definition of patient safety is prevention of errors and adverse effects to the patients associated with healthcare. This is very much important. Okay. The safety starts with patient's name, age, or you can ask date of birth, pregnant before or not. Okay. For example, outside cubicle, you have read, the one scenario, the patient's name was Samantha John, And inside, because you have practiced, the very 2, 3 familiar names. These days, previously when we were studying, we had Tamara John, and with the passage of these 2 years, I'm listening Emma, Emma, Emma everywhere. So, okay. So what will happen that once you will enter into the cubicle, you will start, hi Emma, this is Dr. So and so, and I'm good to see you. Oh, come on, I'm not Emma, I'm Samantha John. Okay. So this will not, give you a good, the outlook at that station as well. Age or date of birth is very much important. Then pregnant before or not is very much important in some of the scenarios. Living status, whom do you live with? This is a very good, the question. Or whom are you at the moment? Okay. Any of the phrase, English word you can use. LMP, in some cases of, the cases of HMB, cases of oligomenorrhea, PCOD, it is very much important. BMI is very much important. These days, it's not always important that you will directly ask that, okay, do you know your BMI? Then you will give definition of BMI as well, height to weight ratio. Either you ask height to weight ratio or either you ask BMI. Both things are okay. Okay. So these days, what I believe, and I hope Dr. Alina will give us a good, the idea about it because she's working at NHS at present. So I think we can ask BMI, Dr. Alina, isn't it? Directly.
Yes, it's important to ask BMI, but because sometimes our management completely based on the BMI. So I believe it's really important. Despite of that, yes, you can say that we are going to check your height and weight ratio and pulse, blood pressure, temperature, something. But it's really important because our management basically based on that in most of the cases.
Exactly. So you can directly ask BMI as well from patient, and you can ask directly the height to weight ratio as well. For candidate, I want to convey this thing is that if you are asking BMI, don't give the definition there and then as well. This is what I see from many of the candidates, okay, around. So what they see, can I ask your BMI? And BMI is height to weight ratio. Okay, either you ask BMI or either you ask height to weight ratio. Okay, don't waste time because every second count in those 10 precious minutes. Smear history is important, contraception history is important, safe medication is very much important. What you are giving her, what you are telling her, what are the effects and side effects as well, how is it going to work, this is very much important. Alcohol history, smoking history, recreational drugs history is very much important. History of allergy, for example, if somebody is allergic to paracetamol, somebody is penicillin, cephalosporin, or any other thing, this is very much important. Because if you know somebody is allergic to anything, so obviously you will say that I will write it down in your case notes. So at least we will be aware of when you come to the hospital. So we will be aware of this thing that we are not going to give you paracetamol at all or penicillin at all or anything. Proper referral is very much important. This also will come under patient safety. All right. Anything else you would like to add, Dr. Alina?
No, thank you, Dr. Zaid. You have mentioned about everything, which is important.
So listen, understand, and hear. Okay, this is very much important. Okay. Outside to so then I will give hold to Dr. Alina to talk about the NHS structure and duties. So let's just finish this thing that how we are going to move for one station. All right. So we are given 2 minutes time. Okay, 2 minutes time. So this is reading time basically. Reading time of question. Okay, reading time of question. Read question again and again. Okay, so plus the first and foremost rule for this thing is don't think back for the previous station whether you did good or bad. Now focus on new question. Okay, forget about it. Okay, sometimes yes, it happens that the previous question, previous scenario, previous station was not up to the mark according to us. Okay, so what we will do that, okay, don't keep on thinking about that because now this 2 minute is for next station. So certainly it will take few seconds to switch over from that, the phase. Then from the from the questions, there is going to be a question. All right. In question, first of all, look for that whether what kind of a task it is. So it will be given outside that this is a simulated patient task and it will assess these domains, 1, 2, 3, 4 domains, and this is your scenario. Okay. Okay, scenario. Read this scenario carefully, keeping in view of these 3 domains, for example. Okay, so you just highlight the name, age, presenting complaint. Okay, what your tasks are. For example, the task is okay. In next 2 minutes, you are going to take the history from the patients. You will assess her concerns and you will manage the case. Okay, this is your task. For example, if you don't read your task and you are just focusing on, what is going to be the safety, what is going to be the communication in this thing. So don't do that, because at the same time you have to fulfill this task as well. All right, this is very much important. What domains to be tested? We have said, note down, is it a referral letter or not? If yes, by whom? Because this is going to be patient safety and this is going to be your situation awareness as well. Okay. Yes, it is going to be present all time. Okay, Asma, iPad, I don't know what your name is, but yes, the question will be there at all times. Okay. Because there is going to be, the screen, like this screen you are seeing at the moment. Okay. Now let me just give you a fair, the rough idea how this is going to be in exam. See, this is going to be the same screen. This is you, this is examiner, and this window is for the examiner who are watching you over, okay? The technical team as well. There is going to be the task, okay? Or if there is role player, there is going to be role player, okay? And for us examiner, there is going to be this separate column where we will do the marking there and then. Okay, you will see examiner at all times in 10 minutes. You will see yourself, you will see question as well. Don't worry about it. Okay, and you will be given a chance to even scroll the screen too. Okay, if you want to scroll the question up and down, okay, you will do that as well. Don't worry. Okay, this is very, beautiful system. I'm sure you will enjoy if you will enter into this Osler system once. Okay, don't worry about it. And if you face any difficulty, because technical team over here is watching you over, so they will jump. They will just immediately come to you. Do you have any kind of problem? You will note down. There is going in the lower down. There is going to be the window. There is going to be a pen column. So here you can note down whatever you want to note. You're not allowed to note anything on your the paper pen, because that will come under cheating. Okay, so you will note down everything on the screen there and then. All right, got my point, Viddu? Okay, great. So formulate how you will start the session. This is important, because in those 2 minutes you have to, no writing on the pen paper, sweetheart. This is going to be on this thing. Okay, on the station, on the screen. Okay, on the screen you can write it down. There is going to be small window. Okay, small window here. There is going to be pen option. So if you want to write down, write down. Nobody is going to stop you. Okay, this is your 2 minutes time.
So will they be watching our screen also?
Yes, yes.
So the screen will be shared.
It is going to be shared. Okay, everything is open. Everything is open for system. If you are slow in typing, sweetheart, now this is your job. Okay, so that's why I'm already telling you again and again, for online system your all reflexes should be very good. Okay, so why you have to type each and everything? You just have to write down, for example, this is age is 39 years. Okay, she is para 1 plus 2 0. Okay, she is here for HMB. That's it. Okay, all right, note it down. 3 things I think we can write. That's it. We are not going to write so many things, because you are not writing. This is not our writing exam. All right, so this is for just for yourself, that if you want to note anything down on the the same the scenario. Otherwise, I don't think there is anything to write, but it's better that you read question again and again and again and again, so it will give you idea what this question is all about. And don't start making keys. This is what I literally don't like as a mentor, and even when I was studying for myself as well. Don't you know write, and don't try to make keys, because in 2 minutes time it is humanly impossible that you will read the station, you will recover from the previous station, and at the same time you will make keys as well. Okay, so just be calm, just try to read question again and again, so not to miss anything. If there is any kind of the agenda, so you will come up when you will enter into the station. So give yourself at least this much leniency, that when you will enter into the cubicle, you will be calm and you will be composed. All right, so in those 2 minutes you will do this thing. And inside the cubicle for the next 10 minutes, what you will do, you have to look confident when you enter into the cubicle. Okay. So if it is a good, the station, if it is a kind of breaking bad news station, so obviously you will not be entering into the cubicle smiley with the smiley face. If you want to smile, give a half smile. Okay. It should not be that your 32 teeth will come out and you have to show the anyone that you are entering into the cubicle. Okay. So if you want to greet somebody, then yes, you can greet. Okay, hello, good morning. I'm Dr. Qureshi, one of the doctor in the clinic today. So then you will sit. Okay. So you will, or if it is a breaking bad news, so obviously, so your expression should be very subtle. You still look, you should still look very calm. Okay. So familiarize yourself with the cubicle. Like I said earlier in the opening slide, that you have to familiarize yourself that how many people are into the cubicle, or if on the screen, in the online screen, obviously you will be familiar with that. Okay, this is examiner, this is role player, and this is lay examiner. So fourth screen is going to be yours. So the screen will be divided into fourth part, 1, 2, 3, 4. If it is 3, so screen will be divided into 3 parts. So don't worry about it. It is going to be same as the real exam. So just focus on role player. If it is simulated patient task, just focus on role player. Don't look at the expressions of the examiner, because examiner will not give you any kind of expression whether you have done good or whether you have done bad. Okay, they will just give you marks according to the keys, according to the the given keys, in fact. Okay, so just focus on role player. Don't just expect that examiner will give you good, acha shabash, you have done good. Okay, yes, you can explain with the help of drawing. On the this the online system, then yes, yet again, if you are good for anything, then draw. But it's not always necessary, even in on-site exam as well. If you want to draw, then draw. But refrain yourself in drawing the live object. For example, if you want to talk about the mode of delivery, so obviously, we cannot draw any of the human being. We are not the drawing master, and we are not the painter as well. It is difficult. Even in on-site it is difficult, sweetheart. It's not like, I mean, that it is easy thing in any of the system. But for me myself, I think it's better that we should not be drawing so many things, unless we think that this is a very kind of easy thing to explain. Okay, so I don't think that this is going to make any kind of big difference. So try to finish your task with the respective domains. Okay. Even if you have finished station before the bell rings, sit comfortably. Don't exchange glances with anyone in the cubicle. And this happens in most of the structured discussion tasks, because in structured discussion tasks we tend to speak in the flow that we will finish our session in, like, I mean, 8 minutes or 9 minutes. For the next the upcoming 30 minutes, 30 seconds, or any of the minutes, just stay calm. Keep your hands in your lap. Okay, just sit calmly. Don't look here and there. Don't just there are many habits what we humans are inclined to. Okay, that we are kind of try to move our hands, try to move our legs and feet. So this doesn't give the good idea in exam hall. All right, so don't do it. If you have finished your session, just sit calmly, wait for the bell, and then just move in a confident way. Then just say thank you if it is role player as well, or if you want to wish her for something, send her the good wishes, or even not, then good day as well if it is a good station, but not in the breaking bad news, obviously. Okay, so in breaking bad news you need to be very sensitive, and you need to be very good at all times. All right. Okay, so till then, if there is any question regarding any domain, you guys can ask. Hand gestures. See, hand gestures, yes, very good question. Very good question. Okay. Yes, we are, many of us are very much inclined to use their hands, because when we are telling something, we do use our hands. Yes, we can use, but try to limit them as well. It's not like, I mean, and plus pointing fingers. Sometimes, we do point fingers as well, so it doesn't give a good idea as well. Okay, movement of hands is okay, because we are trying to explain, we are trying to give our management, so that is quite okay, but not that much. Okay, don't use it that much. So that's why we always say practice, practice, practice. So this way you are going to control yourself if you have any uncontrollable habit for this. All right, Ambrish. Okay, great, great, great. Any other question? Mm-hmm.
Hello.
Hello. Yes.
I just want to ask about that in the online system, when we will enter in the cubicle, the scenario will be still on the screen or not?
Yes, it will be on the screen, sweetheart. Why they will disappear? Why it will disappear? It will be for you for the next 10 minutes. It's in the same manner when we go for on-site exam, you know. So
Yeah.
there is going to be a table in between us and the examiner, and the question will be pasted on that table. So similarly in online, you will be seeing the screen at all times. Okay.
So what if
Even you
there are
can.
so
So
many
it means there
so
will be
many
three
question
screens.
papers?
So it means there will be three screens if the examiner, role player, and me only.
For example, this is screen. Take it as a screen. Okay.
Yeah.
For example,
Yeah.
take it as a screen. Okay. So
Yeah.
here, this is technical team. Okay. This is not your job. So probably you will see, because I am telling you, because I was examiner. So I'm telling you what I used to see. So here it was role player. Here it was candidate. And here it was examiner. So probably, you know, there is going to be partition in one screen, not three screens, partition in one screen. Okay.
Okay.
So if there are more than three people, so obviously there are going to be participants. Remember when we do Zoom meeting, online Zoom meeting, so we do see so many faces in one screen. Okay. So it's
Yeah,
going
yeah.
to be similar to that. Okay. It's not going to be different than that.
Oh, okay.
Okay.
Thank you.
Yes. Yes. Welcome. Welcome. Hand gesture mean when people, you know, there are, it's an, you know, the habit. Many people use, you know, their hands, you know, when they want to explain. So they will do that, okay, this thing, then this thing. I wish I could show you myself. So probably in upcoming session, I will try to engage you guys in, you know, the live session where you guys can see me as well. So this way I can give you better idea about hand gestures. But hand gesture, just try to understand Isra. It's like this, that if I want to explain anything, I will move my hand forward, then I will move my hand laterally, then here, then two hands, this way, that way. Okay. So yes, sometimes it is permissible, but not, you know, in complete session. Okay. So
It's like there were in exam, there's so many papers we used to see, and what if how are we going to see lots of papers in one screen?
this is your job. So you will see there are going to be windows open. So if you want to see this paper, you will click on this window, you will see. If you want to see this paper, you will click on this, it will open. So similarly, like we work in on our laptop, okay, you will have, you know, the windows, everything will be there. Okay. You will scroll down, you will scroll up, everything will be
One
yours.
more thing. Can I ask?
Yes, yes.
One more thing. During the teaching, sometimes some teaching station there we need to um, showing with on mannequin. So or there is something in front of us and we need to show the students. So how we will do it on online?
Now this is college job, that how they will bring such a station, or they will bring any station with the help of pictures. Okay. For example, there are certain that, okay, this is the kind of for example, this is a picture of the mannequin, and this is a doll. Okay, picture of doll here. Now you have to show the candidate. So probably they just want to hear that whether you can do or not. Even in real exam, even at on-site scenarios, they don't expect that you will perform 100%. They will just expect that at least you will be knowing that this is to be done this way. That's it. All right.
And what about the consent paper?
So consent paper will be given to you. Consent paper will be given to you online, and there is going to be pen option as well. So then you can use it. Simple. And it's very easy. Don't worry. I'm telling you, it's very easy. Okay. Okay, Dr. Alina. Now you can show your screen, and you can tell about NHS structure, and then we will move forward.
Okay, thank you, Dr. Zaid. Thank you so much for the wonderful orientation.
Thank you so much.
Yeah, thank you. Just wait one moment.